Very okay. You're watching the Stream Home Edition, which is a show made under lockdown conditions, and we focus on lockdown life around the world. Today, we're talking about the coronavirus and pregnancy. I have the perfect place to start. Luma is a nurse practitioner, and she's expecting.
My biggest concern is the quality of the prenatal care that I'm able to receive in this pregnancy, especially with a lot of my appointments being canceled or switched to telemedicine, which is very limited. And even if there were an urgent appointment, it is filled with anxiety because our support partners not being able to be present with us. There's also been a lot of grief amongst pregnant women with their baby showers being canceled. I know it sounds trivial, but a lot of women have been relying on these baby showers to provide essentials for their baby. And of course, there are other concerns like contracting COVID ourselves and possibly passing it on to our baby or being separated from our baby after delivery. So it's a stressful time for women to be pregnant, but I hope everybody stays safe.
Goodness me, it's stressful just listening to that. Do you have concerns? Do you have questions? Do you even have answers? We'd love that. Jump into our YouTube chat. It is live right now, and you too can be in the stream. Three doctors to help us out with this conversation. Hello, Dr. Karen. Introduce yourself to our audience.
Good morning. My name is Karen Nielsen. I'm professor of pediatric infectious diseases at UCLA in Los Angeles, and I work with mother-to-child transmission of infections.
Good to have you. Hello, Dr. Femi. It's great to have you. Dr. Femi, hello. Welcome to the stream. Tell everybody who you are and your qualifications. Not all of them, because we only have a few seconds to do your introduction, but what makes you relevant to this conversation?
Thanks for having me, Femi. My name is Femi Oladapo. I am an obstetrician gynecologist. I'm currently the interim head of the Maternal and Perinatal Health Unit at the Department of Sexual and Reproductive Health at the World Health Organization. In my past life, I used to see patients and care for pregnant women.
All right, good to have you. Thank you so much. And Dr. Lucky, welcome to the stream. Tell everybody who you are.
Good morning. So my name is Lucky Seacon, and I am an OBGYN in training, spent many years caring for pregnant patients, and then pivoted to focus more on fertility. So now I'm a fertility doctor working in a private practice, IVF center in New York City. And I also work at Mount Sinai Medical Center. This topic is near and dear to my heart because I myself am actually 27 weeks pregnant right now.
Congratulations. Let's start, Dr. Lucky, with you, because what have you asked about your pregnancy related to COVID-19? What is your biggest concern, and what do you know about that biggest concern?
So definitely, in the last few months, we've learned a lot. It's been a very sharp learning curve, but I would say 8 weeks ago, I felt very apprehensive at the fact that this was a novel virus, and the little data that we had was coming from countries and regions in the world that were hit before us in late fall and winter. So the lack of data was very troubling to me. I think now that we, unfortunately, in New York City have become the epicenter of the infection in the United States, we've gathered a lot more data. So I've been talking a lot directly with my colleagues in maternal fetal medicine who are on the front lines treating pregnant patients who are being admitted for labor and delivery and also happen to be COVID positive. So I think we've learned a lot. My biggest questions could be best described as split into two categories. On the maternal side, I worried about whether this virus behaved anything like influenza or other respiratory viruses, which we know can hit women harder when they're pregnant. So fortunately, I think we're seeing that the breakdown of mild to moderate cases versus severe cases requiring ICU level care, that breakdown tends to be very similar to what we're seeing in the non-pregnant population. I was particularly interested in the maternal health aspect because I also happen to have moderate to severe asthma, And so I think anyone who's pregnant with an underlying lung condition is particularly apprehensive about, catching COVID and, being immunosuppressed in pregnancy. And then on the fetal side, there's a lot of questions that we have.
Dr. Lucky, take a pause there for a moment. Dr. Femi, I'm just looking at what the WHO is advising for pregnant women to do. Back here on my laptop, I'm pregnant. How can I protect myself against COVID-19? Wash your hands, put space between you and others, avoid touching eyes, nose and mouth, cough or sneeze into your bent elbow or tissue. It's the same as what everybody else is doing. There's no special way that you can protect yourself if you're expecting. Dr. Femi.
Certainly, you're right, Femi. What we found is that the behavior of the virus at the moment in terms of symptomatology is not any different between the pregnant population and the non-pregnant population. So at the same time, the way to prevent contracting the virus is not any different. Those 4 things that you mentioned are key. Wash your hands regularly, either using alcohol-based rub or soap and water. And, as people are saying, you sing.
Dr. Femi, these are exactly the same, but if somebody is really stressed if they're pregnant, because we've been talking about these basic public health protections for several months now, but as a pregnant lady, anything extra that they need to do?
Actually, there's nothing extra at the moment.
All right.
Those public health measures, they do work. And I think what is happening is that people are not able to implement them correctly. One of those things that you showed on the screen now, which is avoid touching your face, is probably the most difficult thing to do.
Oh yeah, it's like a challenge, Olympic challenge.
Washing hands, it's quite effective. I think what is problematic is that a lot of people don't know how to wash their hands properly. So there are videos that have been issued on washing hands for a minimum of 20 seconds or at least, and ensuring that you wash all parts of the hands, which ordinary soap would do.
So Dr. Femi, my takeaway from here is you do exactly the same as the rest of the population is doing. It doesn't matter that you're having a baby. You do exactly the same. In fact, you have to be even more careful about it. Dr. Karen, let me just bring you in here because I have another doctor who's online. We told our online community that we were doing this show. And Dr. Rajesh says, is there any evidence of fetal malformation due to COVID-19 infection in pregnancy? Apart from, and then he mentions the 3rd trimester abortion, that's the last 3 months, and there has been perhaps an indication that that may be a case. Dr. Karen, you look at newborns, what do you know?
Well, there is so far no evidence that COVID would behave, that the novel coronavirus would behave like any of the very what we call teratogenic viruses that cause malformations to the fetus. For example, Zika, which was a catastrophe and caused all these very severe fetal malformations, deformities, and so forth. But there's no evidence yet that COVID does cause, at least from ultrasound data, any fetal malformations. We have to remember this is an epidemic that started in January, so we won't have that many women who were infected in the 1st trimester giving birth. That will happen later in the year, so there's no real data yet. But as far as we know from all the ultrasound data that has been evaluated thus far, there's no evidence of any congenital malformation associated with the virus, which is very reassuring.
All right, doctors, you can push back here, but am I right in thinking you don't really know that much about COVID-19 and pregnancy?
I think we have a lot more information. Sorry. I think we have a lot more information, particularly from the 3rd trimester, because we have women in the United States that have delivered and they're known to be COVID positive at the time of delivery. And there have been some studies out of Columbia, New York Presbyterian, albeit with lower numbers, just because we're still in the learning phase, where at least 43 women in the 3rd trimester who delivered, they had the opportunity to follow up on the children and do testing, and also test for the virus in the breast milk, the amniotic fluid, the cord blood, and the placenta, and they were unable to detect the virus. So I personally found that to be a very reassuring study, and I think it echoed some of the smaller studies that came out of Wuhan earlier this year.
When you meet other pregnant mums and they know what you do and they know your speciality, what do they ask you about, Dr. Lucky?
A lot of the questions I get asked about are family planning related. I think, treating infertility is a very time sensitive matter, mainly because of the fact that women are born with a limited number of eggs. So over time, the quantity and quality of eggs diminishes. And so I think the biggest source of apprehension was 2 months ago, how long are we going to wait till we have enough data to know whether it's a smart idea to proceed with our family building goals. So a lot of patients want to know, does this impact my fertility? What impacts could this have on my pregnancy? Is it wise to move forward at this time, or preconception? Should I be taking a pause on my plans? Those are the most common questions I get asked.
Dr. Femi, that's almost an ethical conversation, isn't it? It's like, is it okay to have a baby now when potentially there's a big strain on the various health services around the world? Doesn't matter if you come from a developed nation or a developing nation, health services are under stress. That ethical question, is that something that even the WHO, the World Health Organization, do they even look at that?
WHO is looking at every perspective of the virus, including ethical issues, not just around pregnancy, but as it relates to adult population management as well. But I think, thinking whether or not a woman should conceive at the moment, I mean, it's a kind of something that has to be individualized. And at the moment, what we're sort of saying is that there are all of these things that my colleague spoke about, the fact that we do not have any evidence at the moment to indicate that the virus can cross from the mother to the baby is very reassuring. And even
but I have seen newborns who may have contracted it, and we don't know at what stage, but shortly after being born. So would they have got it as they were coming through the vaginal passage? Listen to me and my biology here. Or what stage would newborns, Dr. Karen, you come in here, what stage would newborns have contracted COVID-19? How would they get that?
Well, there have been some papers primarily coming out of China looking at what we call perinatal transmission, how frequent the virus will pass from the mother to the baby. So in those papers, it's reassuring to find out that in most situations, the baby does not seem to be infected at the time of birth, but there have been babies who have contracted and come down with the infection within 24 hours, 36 hours, 72 hours of being born. Now, it's unclear whether the virus was in the vaginal canal. Many of these babies actually were delivered by C-section. What is the mode? Very likely they could have been infected right at the time of birth if they came into contact with the mother, and the mother, this is a highly infectious virus. So there's not clear-cut data to show the transmission occurs, through the vaginal canal or through the placenta or, during pregnancy itself. Having said that, there have been a few papers now that have found the virus in the placenta.
Let me just bring in here on YouTube. Hi, Sayeb Khan. Sayeb asks, is COVID a threat more significant at a later stage of pregnancy? Who wants to take that one? Later stage of pregnancy, is it a bigger threat then? Dr. Femi.
Right now, the information that we have is scanty. Most of the women that have been studied were those women that got infected in the third trimester. And as my colleagues have said, there is no clear-cut evidence at the moment that the virus gets transmitted to the baby at that time. If we flip back to what we've learned from SARS and MERS in the previous epidemics, there is no evidence to demonstrate that there is higher incidence of early pregnancy loss or miscarriage for women who got infected with those viruses even early in the trimesters. So I would say that for what we know now, we feel pretty comfortable, not super confident because the data is still evolving and we'll learn more as we gather more data. But at the moment, I do not see any serious concern for a woman to be worried about mother-to-child transmission of the virus if infected in the third trimester.
Doctors, let me share with you a conversation that is going back and forth with our online viewers on Twitter. So let's start here with Method with Madness. COVID-19 can cause blood hypercoagulation in the arteries of the lungs, the heart, the kidneys, and the brain. Imagine what that would mean to a fetus. It's unconscionable to get pregnant now. Birth control should be free, including the morning after pill in multi-packs. We just go on to a counter opinion here for Niamogo, and Niamogo says that procreation must continue, just like the hunt of COVID-19 therapy and vaccine must. Let nature take its course in order to replace the precious lives that have been lost around the world. So 2 dueling opinions, and then let me just take you to Anastasia Berg. And Anastasia was planning her family. She's planning to get married. She's planning her family. And then COVID-19 happened, a global pandemic, and it gave her pause. And she was struggling to work out, what do I do? This is what she told the stream earlier.
The truth is that even at the best of times, deciding to have children is very scary. But I also think that as long as we believe that life is worth living, which means that even in the face of obstacles and challenges, be they corona or climate change or politics or the economy, as long as we think that in the face of all of these, life is still something that's worth fighting for, then I think that we shouldn't worry about whether or not it's still good to bring new life into the world any more than we worry that it's good to sustain our own.
Dr. Karen, I remember you saying that you worked with Zika, and women were terrified during Zika because they knew that it had an impact on their babies. Are you feeling the same kind of fear around COVID-19?
I don't believe so. I think the situation with Zika was fairly different because it was proven, documented early on, that it was causing fetal malformations that were detected around 20 weeks of pregnancy. By that time, you could really see the ultrasounds and see that there were very significant, damage to the central nervous system. It's different with COVID. COVID causes injury to the lungs. If it affects a pregnant mother, of course, the babies will depend on the maternal health. So if a mother becomes very sick with COVID, this will, of course, will have repercussions, as with any other disease, to the baby in terms of maybe there will be premature deliveries, there could be complications. Whenever a pregnant woman has to go on the ventilator, of course, that would affect the outcome of the fetus as well. Having said that, fortunately, pregnant women are not at higher risk than the general population, as we all have reviewed here.
Mm-hmm. I want to bring in Amadine. Amadine is a new mum. She gave birth in Belgium, in Brussels, just a few weeks ago. Her baby girl is doing well, but at some point during her pregnancy, she was told that she had COVID-19, and these are her thoughts. Have a listen.
Donc on m'a fait un monito et tout ça, et ils m'ont dit ok, on va aussi vous tester.
So they did a pregnancy monitoring and told me they would also test me for COVID-19, and I thought it would be negative. The next day, my gynecologist called me to tell me that it was positive. We nearly fell off our chairs because this had a lot of consequences. It meant my husband could not be with me when I was giving birth, and that I was going to be on my own. It was the start of a completely different process. So the 2 days ahead of the childbirth were much more stressful. I was so afraid for her.
It's so rare to have 3 doctors who specialize in childbirth or pregnancy or newborns. I'm going to get you to work. I'm going to do a speed round here. I've got questions on YouTube. Doctors, you are going to give me answers quickly. No pressure. Mojo says on YouTube, should women take extra vitamin D or other vitamins? Dr. Femi, you take that one.
Vitamin D, especially, our current recommendation says that there is no evidence to demonstrate that it improves outcome. So I would say take iron and folic acid regularly, but multivitamins, multiple micronutrients, those are things that at the moment WHO is recommending under.
Thank you, Dr. Femi. Moving on, we've got more questions. Mitchell. Thank you, Joanne Mitchell. I am presently pregnant in the Caribbean and I don't like going out unless I have to because I want to avoid COVID-19 and other infections. Dr. Lucky, pregnant, you're worried about going out. Should you be worried about going out? Should you stay in? 9 months is a long time to stay in.
I think that it is. So I think everyone has to have an individualized plan that makes them comfortable. I can speak from my own personal experience that I have truly tried to minimize all exposures possible. Maybe it's out of an abundance of caution. And if that's the case and I was being overly paranoid, but everything turns out okay, then I'm happy with that. I think at some point you do have to live your life. So I think it's fine to, leave your house if you need to go to the grocery store. But I've been taking precautions, wearing a mask, exercising, hand washing, and doing it often throughout the day and minimizing my exposure to groups of people from a very early stage, just out of an abundance of caution and being overly vigilant. I don't think pregnant women have to lock themselves up. And I think it's reassuring so far that we're not seeing that this is a virus that behaves like Zika, where there's a real known risk. But I also think it's important to balance that lack of evidence of risk doesn't equal lack of risk. And we should stay
It's lack of
open-minded that there
data
could be
right
things
now.
that we need to learn. Right.
All right, Wafa is on YouTube. Thank you, Dr. Lucky. Appreciate that. Wafa says, for the women who are about to give birth, how do you protect yourself and protect your baby? Dr. Karen, is that possible?
Well, in some hospitals, like the hospital I work in, all the women who come in to deliver, they're actually tested for COVID-19. So there's a blanket testing of all women so that, there's not only protection to these women, but also protection to the staff, because there's, of course, concern of exposure. So that is a decision that has been made in that sense. Certainly, healthcare has to, and pregnancies have to be handled the way they would be handled normally. Women have to come in, they have to be checked, they have to be evaluated. We live in this area of telemedicine. I think you just have to follow through with what your doctor says, be compliant, be vigilant, and hopefully everything will be taken care of. We should not avoid medical care.
I'm just looking at Clovis R. Silver. Let me just make this a little bit bigger so that you can see Clovis on Twitter back here. And he's been listening and watching you, doctors, and he's wondering about the psychological aspect of being pregnant in the time of a pandemic or a lockdown. How do you recognize the signs of anxiety, depression, and stress in oneself and others? Dr. Lucky, I've just been watching you. You're so impressive. You are sitting there, you're being so calm, you're advising other people, and you are also expecting a baby during a global pandemic. How do you control that stress that you have as an expectant mum anyway?
I think you have to acknowledge that it's stressful. And something that I learned very early on going through this, as both a professional and from a personal standpoint, is that it's important to not overestimate your ability to deal with the stress of the unknown. And I think mobilizing whatever resources you have around you, I think it's important to have an obstetrician that you feel really comfortable talking to and reaching out to, especially during times like these. It's different for everyone. Maybe telemedicine isn't for every patient, but I definitely have been employing the use of telemedicine throughout my pregnancy, and it's made me feel calmer and less anxious. But for some patients, it might make them feel more anxious and less connected to their doctor. So I think you have to find a way to garner support from your personal circle, but also from professionals that are taking care of you. And I think there is a lot to be said for reaching out to mental health professionals as well if you feel that you're struggling with anxiety and you're overwhelmed.
Thank you, Dr. Lucky. Thank you, Dr. Karen. Thank you, Dr. Femi, as well, for bringing your expertise to our topic of coronavirus and pregnancy. There's so much more still to find out because it is a novel coronavirus. Let me leave you back here though, with what the WHO are advising. Good advice for you if you're pregnant or not pregnant. How do I protect myself against COVID-19? Well, you wash your hands frequently. You put space between yourself and others. Avoid touching your eyes, nose, and mouth. That is a hard one. Cough or sneeze into your bent elbow or tissue. You know the drill. Thanks so much for watching this episode of The Stream. Thanks, YouTube. See you next time.